A framework for redefining success in the NICU. Early initiation of expression, sustainable expression routine, and mother-baby connection, not necessarily direct breastfeeding. In the healthy newborn setting, success in the first 100 hours often means a baby who's latching well and transferring milk. That's not realistic for most NICU families, so we need to clearly redefine what we're aiming for. Getting milk removal started early, building a milk expression routine that the parent can actually sustain, and fostering connection, even when the baby is being cared for by others. If NICU moms are trying to meet the standards set for moms of healthy term babies, it makes sense that they're going to feel like they're not doing enough for their babies. Phase 1, initiate. This is between 0 and 24 hours after birth. Skin to skin after birth when possible. Initiate milk expression, orient the family, and begin relationship building despite separation of the mother-baby dyad. Skin to skin after birth whenever possible and for as long as possible. Begin expression as soon as mother's stable, ideally within 1 to 3 hours of birth, within 6 hours per the baby-friendly NICU standards. Orient the family to what's happening and why it matters. Begin relationship building despite the separation. Show moms how to hand express their colostrum and treat the drops they get out as meaningful therapy for the baby. Phase 2, build, between 24 and 72 hours after birth. Ramp up the frequency, clarify technique, skin to skin whenever possible, and normalize NICU pumping life. So ramp up the frequency to 7 to 8 expressions per 24 hours. Optimize technique, comfort, hands-on pumping, positioning, skin to skin whenever possible. Normalize NICU pumping life, the alarms, the interruptions, the chair next to the isolette, who's around that can help them, how to take breaks for eating and drinking, and personal needs. By day 2 and 3, we're shifting from get started to build the routine. This is where technique matters, comfort, hand expression with pumping, positioning. It's also where we continue to advocate for skin to skin whenever possible. And critically, this is when we normalize what pumping in the NICU actually looks like. Those alarms, the interruptions, pumping in a chair next to an isolette, thinking about asking to use the curtains or barriers for privacy if they want. We're not pretending that it's easy. We're helping them build a life around it, a temporary life. Phase 3, assess and plan, between 72 and 100 hours after birth. Assess day 4 volume, triage support, start planning for day 14 and the first breastfeeds when the baby is ready. Assessing day 4 volume is the first checkpoint. Triaging what support is needed based on the volume category. Planning for the day 14 goal and discussing the possible pathways to first breastfeeding and how we will know that the baby is ready. Day 4 is our first real checkpoint. It's not a pass or fail. It's just a signpost. We look at 24-hour volume, we watch for risk factors, and we help mothers adjust their plan. When things are on track, we reinforce what's working. For those who are at risk of stopping or struggling, we escalate support before they leave the birth hospital, before they're pumping alone at home without a lactation consultant down the hall. We also start talking about what's next, day 14 goals, and working with the baby's whole care team to plan for when direct breastfeeding might enter the picture.